The second wave of COVID-19 has been devastating. The system's apathy and gross mismanagement has left us struggling for breath. But thankfully, all is not lost yet. We've seen innumerable faceless, nameless heroes who've come forward to help those desperately scrambling for basics and who've restored our faith in humanity yet again. Doctors, nurses, journalists, mental health practitioners, volunteers, drivers, delivery staff, to our local kirana wala. I'm sure I'm forgetting many others. We owe a great deal to them, because without their selfless services, we wouldn't have made it thus far. Different Strokes is proud to have had this opportunity to speak to a few of these COVID heroes, who have been working relentlessly by putting themselves and their families at a serious risk of infection. We couldn't thank them enough. But I hope through this series, we're able to tell them how grateful we are to each one of them. In today's podshot, I speak to Dr. Disha Sharma, who describes this crisis as exhausting. She's currently serving as a frontline doctor at a government hospital in Chandigarh. What are your day-to-day challenges at the hospital, and how are you coping with this crisis at a personal level?
The biggest challenge we are facing right now is we have to do our duties, but then we always have this fear of getting infected ourselves. Like myself, I have not been infected by COVID even once, though I've got my vaccinations. But we are always in such high exposure environment. Even if we are wearing a PPEs, a double mask and everything, we have this risk of getting ourselves infection. And ज़्यादा बड़ा हमें risk लगता है taking this infection back home. Since I am a localite, I live with my parents, so that is a bigger fear. Patients anywhere between 50 to 55 on one floor, and only 2 to 3 residents were managing them.
आप किस तरह मैनेज कर रहे हैं? अगर 2 से 3 डॉक्टर्स 50 पेशेंट्स देख रहे हैं, how are you managing? I'm sure there are critical patients as well, and you're running around hustling, trying to help everyone.
Individual departments में भी अब shortage है. Like I am from Department of Transfusion Medicine and Immunohematology. So my department also suffers at the back end if I am going out for my COVID duties. But like from the last 1 month, I can say कि मैंने first time इतना मतलब crisis देखा है कि we have to sometimes wait कि even oxygen का भी हमारे अपने 32 के hospital में they have asked कि जो elective surgeries होती हैं, जो surgeries जो इतनी बड़ी emergency नहीं है, अगर वो रोकी जा सकती हैं तो रुक जाए, so that the oxygen supply can be mediated towards COVID wards and everything, जहाँ पे इस टाइम पे बहुत ज़्यादा ज़रूरत है. I had never even imagined कि कभी ऐसी situation भी आएगी कि किसी oxygen supplier या किसी chemist को call करें, आगे से everybody will refuse कि नहीं है.
तो इतना सब distress है आसपास, इतना I don't know what to say, इतना severe humanitarian crisis हम लोग कभी झेल रहे हैं. पूरा कंट्री देख रहा है, वर्ल्ड ओवर सब लोग देख रहे हैं, इंटरनेशनल मीडिया तक देख रहा है. Does it make you angry? Feel helpless?
Over last 1.5 month ये change देखा है कि like last year तक since the cases were going down and we had got our vaccination, the vaccination was coming out, we were very hopeful कि चलो मतलब कि हो ही जाएगा खत्म, कि हो गया मैनेज, इतना बुरा हाल नहीं होगा. बिकॉज इससे पहले वी हैड सीन कंट्रीज लाइक इटली, फ्रांस एंड एवरीवेयर जहाँ पे इतनी डेथ टोल थी. एंड कंपैरेटिवली वी वर हैप्पी आल्सो एंड शॉक्ड आल्सो कि इंडिया की इतनी पॉपुलेशन है एंड इतनी इम्यूनिटी है लोगों की कि बच गए.
Are you seeing more young patients coming in?
Yes, young patients with severe diseases and even higher mortality rates. मतलब पहले ऐसा था कि हम खुद देखते थे कि mild सी disease होती थी, very easily treatable at home. But now I have seen people healthy and with no comorbidities like me and like my friends. They are on ventilators. They are taking 15, 20 days on oxygen to get well, and still they are so weak. मतलब the worst I have seen a 21-year-old dying with a cardiac arrest. मतलब recently last week की बात है. It can take a toll on anybody now.
It's not partial to
No.
anyone. And tell me, Dr. Disha, how is this impacting your own mental health? Seeing so much misery around, so many deaths of young people, and obviously there's a feeling of helplessness as well, because आप सबको तो कोशिश करके भी नहीं बचा पा रहे हैं.
Irritated and frustrated, I could say. अपनी मेंटल हेल्थ तो डेफिनेटली काफी ज्यादा अफेक्ट होती है कि समटाइम्स इट इज लाइक कि यू बिकम नंब कि अब क्या करें. बट पीपल हु आर वेरी यंग और इन देयर मिडिल एजेस हु हैव किड्स एंड बिकॉज वी नीड टू मतलब यूजुअली सिंस द अटेंडेंट्स कैन नॉट स्टे विद देम, तो हम उनको एट डेली बेसिस पे उनकी रिपोर्ट्स देते रहते हैं पेशेंट्स की कि आपका पेशेंट इतना इम्प्रूव किया कि नहीं किया. एंड समटाइम्स इट्स लाइक कि पिछले दिन हमने उनको बताया होता है कि ही इज गेटिंग बेटर, एंड देन यू हैव टू कॉल देम इन द मिडल ऑफ द नाइट टू इन्फॉर्म देम कि वी कुड नॉट सेव हिम और ही पास्ड अवे. जितना अटेंडेंट्स के लिए शॉक होता है उतना हमारे लिए भी शॉक होता है टू गिव दिस न्यूज टू देम. इट्स नॉट एट ऑल इजी. मतलब कि दिस इज अ वेरी कॉमन थिंग अमंगस्ट द पब्लिक. उनको लगता है कि इनका रोज का काम है तो इनको क्या ही फर्क पड़ता, बट ऐसा नहीं होता.
Probably you've seen too much and you don't know how to react anymore. Maybe it's that.
हाँ, and people take it कि इनको फर्क ही नहीं पड़ता.
But actually, I see a lot of doctors on Twitter putting out videos saying that we're burnt out. अब हमसे नहीं.
We are actually drained. नहीं. And this is not just me, this is everybody. Even in my circle, everybody has the same feeling कि ये कब खत्म होगा, इसका जवाब किसी के पास है तो प्लीज दे दो. रोज सुबह उठ के ये सोचती हूँ कि एक दिन और निकल गया, कि आज किसी को मतलब कोई इन्फेक्शन नहीं हुई या मुझे कोविड नहीं हुआ या मेरे किसी नियर एंड डियर वाले को कोविड नहीं हुआ, कि चलो एक दिन और निकल गया.
What's keeping you on? How are you going on and on with this?
This profession, this study teaches you you have to keep your patients before yourself. And हो जाता है, you know कि this is your duty, this is my responsibility. You leave the house thinking this is my responsibility, I have to. I took this profession because I wanted to do this. So anything that comes in this way, I just cannot say no or I cannot deny it. Also there are मतलब कि if there are 10 to 12 people who do not appreciate you, you always come across 2-3 people who appreciate you. And when you see your patients getting better, they going home, तो वो एक sense of satisfaction होती है कि चलो ठीक है, something good came out of this.
Right.
It's okay.
But tell me, do you see light at the end of the tunnel, Dr. Disha? Are you hopeful?
I am. I have to be. If I am not hopeful, then I cannot pass that energy to anybody else. क्योंकि अगर मैं ही होप खो दूंगी तो पेशेंट्स या अटेंडेंट्स मुझे पूछते हैं तो मैं उनको क्या जवाब दूंगी.
Have you come across anything that's very unnerving?
Some people still do not want to accept that COVID is a disease. They just do not want to accept. Even when they are admitted in the hospital with it, they are being treated for it, they do not want to accept it.
What are you saying?
They feel कि सरकार का या डॉक्टर्स का बनाया हुआ एक बीमारी एंड बस ऐसी है, तो ऐसा कुछ है नहीं है एंड ऐसे फैलती नहीं है कि मैं बीमार हूँ, आई एक्सेप्ट दैट, मैं आया हूँ, मेरा इलाज हो रहा है, बट कोविड नहीं है. They fight with us कि हमें घर भेज दो, we want to go home, हमें जान के बिठा के रखा हुआ है. And you keep on telling them कि नहीं मास्क पहन लो या ये कर लो. No, they will not accept it. They will say कि नहीं. Recently, like 2-3 days back, a patient had just come out of the ICU. It was his day 2 in the ward and he was fighting with me at 2:30 in the night कि मुझे अभी के अभी डिस्चार्ज करके घर भेजो, कि मुझे जबरदस्ती आप लोग रखते हो.
Tell me, Dr. Disha, what is the one thing or two things that you expect from the system that is going to make the lives of doctors a little easier?
डॉक्टर पेशेंट रेशो डेफिनेटली मतलब कि डिक्रीज होनी चाहिए. एक one doctor should not be running after so many patients. And secondly, better pay rules, especially in government hospitals. जैसी पॉपुलेशन इंडिया की है एंड जितना लिटरेसी लेवल है, गवर्नमेंट हॉस्पिटल्स को ही मतलब कि टारगेट करते हैं, वो वहीं आएंगे. तो एक तो डॉक्टर्स कम हैं, ऊपर से फिर गवर्नमेंट हॉस्पिटल में एडमिशन्स कम ले रहे हैं.
What's the last piece of advice or maybe a motivation that you would want to send out to all your doctor fraternity?
That I know everybody is burnt out, everybody is drained, but this is still not the time that we can give up. We
Right.
just cannot.
Thank you so much, Dr. Disha. This was really good, and I don't think we can thank the doctors enough for whatever you're doing. It's not easy, and we really thank you, and we owe you from the bottom of our hearts. Thank you very much.